Good afternoon. I'd like to call to order the Health and Human Service and Aging Committee, Wednesday, October 30th, and 1:05. Madam Clerk, can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Turner. Ms. Turner is absent. Mr. Miller.
Present.
You have a quorum.
All right, I'd like to make a motion to excuse Councilwoman Turner. She is out ill today. Is there a second?
Second.
It's been moved by Conwell, seconded by Miller. All in favor, please say aye.
Aye.
All right, anyone signed in for public comment, Madam?
No, Madam Chair, no one has signed in.
Approval of the minutes for the October 16th meeting.
So moved.
Second.
Moved by Sweeney, seconded by Miller. All in favor, please say aye.
Aye.
Right. Madam Clerk, if you could read the first item into the record.
Resolution 2024-0387, authorizing an amendment to an agreement with the Metro Health System for comprehensive medical services for families involved with the Division of Children and Family Services for the period January 1st, 2023 through December 31st, 2024, to extend the time period to December 31st, 2025, to change the scope of services and terms, and for additional funds in the amount not to exceed $1,551,000, effective upon signature of all parties.
Welcome.
Thank you. Good afternoon. Marcos Cortez with Health and Human Services on behalf of Children and Family Services. With approximately 2,000 children and youth in care, DCFS has determined that there is a need for full access to trauma-informed medical services that could appropriately address the significant challenges that children and youth are faced with when being removed from their home or placement. In order to pursue the safety, health, and well-being of children in custody, DCFS offers comprehensive medical services, including screening and assessment of healthcare needs of children and youth, including comprehensive post-placement physicals, also psychotropic medication consultation, and alcohol and drug testing for caregivers, youth, or other adults in the home. These services are provided by Metro Health, which was awarded via an RFP in 2023. We are amending again this contract to extend the time and add funds and make changes to the scope of services. We are exercising our last option year for this contract. We will issue another RFP in the middle of 2025 for services to begin in 2026. We have, excuse my pronunciation, but Aparna Roy and Anna Velez from Metro, and Director Jackie Fletcher and Karen Storman from DCFS, who can answer any specific program-related questions.
All right. Any questions? Yes, if you want. Metro, please come up. All right, there. State your name for the record.
Good afternoon. I'm Aparna Roy, Chair of Pediatrics at Metro Health.
So what do you want, Marty?
Through the chair, I just welcome.
Thank you.
Metro is a partner for us for better or worse, right? And we do a great job together. And I hear nothing but wonderful things about the operations that you run. And other parts of Metro we keep working with. But tell us what you're doing so we can have a fuller understanding. And the last year of a contract, and hopefully you'll want to put your RFP out and keep doing it for us.
Absolutely. Thank you for the compliments. And what we are doing and what we want to continue doing is that medical home concept for these foster care children. We want to wrap our arms around them and take care of their every aspect. As was mentioned, so we provide the triage facility, we provide the post-placement physical, and any other medical needs that they may have before the family, when the child gets placed, they decide by themselves to change the provider. We are available 24/7. So we want to consolidate operations, though, on the main campus because we want to meet the children where they are. Most of the children want to present or are being presented on the main campus. We had thought about, extending our services to Parma and Cleveland Heights. What we found in this 1 year is we barely saw any volumes there. We would deploy our providers there, but they wouldn't see any patients. So instead of that, what we want to do is provide a very robust, holistic service on main campus, consolidated in collaboration with DCFS and the caseworkers, so that we are able to serve them completely in one place. Because one provider going to a peripheral site, they are by themselves, they are not able to do all the services that we would require. I think in addition to the medical care, the psychotropic medications, and taking care of their mental, physical, all health, and also addressing the social determinants of their health, to the best of our ability at that moment is our goal. So we want to continue it, and we request the request that was made.
And
We
through the-
support it.
And through the chair, thank you for the explanation. And it's not your goal, it's what you're doing,
Yes,
right? And you're proud of it.
absolutely.
There was an RFP put out. You won the RFP. You're in your last year of it.
Yes.
Is there anything in the RFP that you agreed to work that you would want to add in the next one? Maybe we want to do this thing, or maybe, or if you're in the RFP and something else comes up that you think would be added value that's not in there, do you have the ability to talk to the county and say that we want to add this as a function and work out what we're getting paid for?
Absolutely. We do have a very collaborative relationship that we are able to assess the unmet needs that we have in addition to whatever we are doing, and then bring it up as a potential service that we can offer. For example, trauma-informed care is absolutely essential in these children. Inserting child life, to some extent, when we are able to, who are the experts in providing trauma-informed care, into this mix, I think would be very beneficial for these children. We do not currently have that capacity to do that, but with the additional funding, we are hoping to be able to achieve all of that.
And through the chair, to the presenter, is that a decision that comes from the county through your recommendation, or is it collaboration and you both agree to it and say, let's move forward? How would that work?
I would think that, this is a proposed idea from our side, which can definitely be vetted and see what it would entail before it becomes a formal recommendation from our side.
Through the chair, I want to thank you, and you gave me a significant comfort of your ability and Metro's ability to provide the service that are necessary for the children that are most vulnerable. So
Thank you so much. It's our privilege to serve these children.
Thank you, Madam
Thank you.
Chairwoman.
Thank you. I just wanted to ask, this includes dental, correct? I always ask this, I don't know why I can't remember.
Yes, it does include dental services. Thank you.
Any other further questions? Councilman Miller?
Yes, Madam Chair, to Mr. Cortez, how does the cost for the upcoming year of $1,551,000 compare with what we're expected to pay for this year?
I believe it's the same amount as what we've paid for this year.
And it says that the scope of services and terms are changing. What are the nature of the changes?
I'm actually going to ask Karen Storman and Director Fletcher to address those changes.
Good afternoon, Karen Storman with the Division of Children and Family Services. Madam Chair, to Councilman Miller. There were slight changes to the scope of work that reflected three areas in which we noticed required some modifications. As Dr. Roy had mentioned, originally the contract included triage locations in Parma and Cleveland Heights, and utilization numbers didn't prove that that was a service that we needed to continue in using our resources as best we could. The other scope modification would be to reduce the behavioral health therapists that were originally identified in the proposal. There were currently 2 FTEs due to low volume and referrals, in addition to some increased capacity within the Division of Children and Family Services, in which we've added some trauma-informed therapists to our current staff. That position was determined to be no longer necessary, and we had originally identified a need for second opinion services that we were utilizing the foster care clinic at Metro Health for. However, we were able to obtain those services through Ohio's Medicaid Managed Care Plans, in which is a low-cost, no-cost service to the agency. And so that was another decision to modify the scope to reflect that change.
And Madam Chair, are all the services provided on site at our facility, or in some cases are the children transported to Metro?
All services are provided, Madam Chair, to Councilman Miller. All services are provided to the children at Metro Health Facility. So those services are being provided at the hospital or a neighborhood family service center to provide the best service for the families. We triage the young people who are being placed into our care via the main campus.
So none of the services are being provided at our facilities, is that correct?
That is correct.
Okay. One more question from Mr. Cortez, if I might. You mentioned that we're going to be going out for an RFP again next year. Who do we know of other than Metro that conceivably could bid on this?
So when we put these out there, we do have to have a list of providers, a plan holders list. So that plan holders list has to have at least 10 different vendors. So UH could be one. It could be DI. It could be a host of others. I don't have a full comprehensive, but there are potentially other providers out there that could respond to this. We haven't had any others in the past. It's usually been Metro to respond.
Okay, thank you.
I do have a correction. I believe this contract actually is a little bit more than what the annual amount was the previous 2 years. I believe it was 1.5 for the first 2 years, and this is 1.8.
I don't see 1.8 in the legislation.
No, me too.
1.5, is there a
Oh,
typo?
is it 1 point? Oh, I'm sorry, I was reading the wrong. So there was a second amendment. I'm sorry, this is the third amendment, I believe. I'm sorry, my mistake.
Okay, so it's 1.5, correct?
Yes, that's correct.
Yeah, and just to answer your question, Mr. Miller, way back when there used to be UH, or I remember there were others, UH and Cleveland Clinic used to bid. I think it's always been Metro that has won out, but there used to be other bidders for this. My question to you, Marcos, would be, we don't just cut a check for 1.5, they invoice us?
Yes.
Okay, so it's on a monthly basis?
I actually have to, again, would ask Karen, is it monthly? Yeah, it is monthly, yes.
Okay, and so if there's some money left over, what happens?
So if there's money left over in any contract, depending on if the contract continues, so if the contract would continue to next year, we could actually move that money into the following year. But if that contract were to end this year and be done, that money would get decertified and go back to the balance.
Okay, so if they had 50,000 left over, and this wasn't the option year, that 50 would roll on to the other amount, or?
It wouldn't roll onto it. We actually have to, there's a process called a cover modification. We would actually have to move that money from 2024 into 2025.
But it would be in addition to what the amount was?
Yes.
Okay.
But it wouldn't exceed the value of the contract.
Okay.
So they wouldn't come before the board, or for the council.
All right, thank you. Anything else, anything you'd like to share, Director? All right, Thank you. So I'll make a motion to second reading.
No, it can go 3 full.
Oh, and we gonna do that. We're gonna I make a motion to move R 20240387 to the full council under second reading.
Second.
So it's been moved by Conwell, seconded by Miller. All in favor, please say aye.
Aye.
Thank you.
Woo-hoo, second reading. Hard to come by. All right, we're gonna move on to, presentation. Please state your name for the record and why you're here.
Good afternoon, members of the council. My name is Michael Bernat. I'm the executive director at the Westside Catholic Center. I'm here to give an update on our current work, our use of some ARPA funds, and to thank you all for your support of our center through those funding, particularly Councilwoman Conwell, in her flexibility in understanding our current position here. I have a short presentation for you, so you have some visuals as well. I'm aware that you are probably familiar with our work, so I hope this is a reintroduction and an update for most of you. We are a 47-year-old agency located in the Ohio City neighborhood that specializes in social services, primarily directed to those experiencing the cycle of poverty and homelessness. But our mission statement is such as on the slide there, that we serve all who come in need of food, shelter, clothing, advocacy, and a path to self-sufficiency. We were founded in 1977, became a 501c3 agency in 1978, headquartered in that same location in Ohio City on the corner of West 32nd and Lorraine. We are not affiliated formally in any way with the Diocese of Cleveland or Catholic Charities. We're governed by our own board of directors who receive no compensation. We have 5 main programs. This resource center is the one that was primarily benefited from the ARPA funding that we were awarded. This program is truly our entry-level program. We serve the most people. We have the most impact on the community. It provides mostly basic needs resources. I like to call it both the first and the last line for many people in our community who have nowhere else to go, primarily through our meals program, our day shelter, showers, mailing services, as well as some other supplementary programming that we do in the afternoon, ranging from expressive arts to other ways to get people to socialize and alleviate their isolation in some way or another. We've seen an exorbitant need, as I'll express later, mostly in this programming this year. Secondarily, we have one of 3 family shelters in the continuum of care in Cuyahoga County. We're one of 3 emergency shelters. We're a 34-bed facility called Mariah House. 7 of those beds are designated to female veterans who are placed with us through the VA. The remainder of them, of the families, come to us through Frontline Services Coordinated Intake. I think it goes without saying, in this day and age, we are full every night in the family space. There's a wait list of 76 families as of yesterday waiting to get into shelter. We are not specialized in the DV space or any other type of barriers. We're a housing first model in that regard. But we have a very nice facility where people are heavily dignified and provided 3 meals a day, as well as laundry services and housing plan assistance. From there, we have also, under that same umbrella, our Zacchaeus Housing Solutions program. It's a HUD-funded program in partnership with Eden, who does housing location for us, and we provide supportive services through case management for families who are subsidized rent for 12 months. Also, again, working towards a housing plan evaluated on a 14-point metric system called the Arizona Assessment with their case manager bi-monthly. With the goal of them being able to retain that housing at the end of that 12-month subsidy period. Beyond that, we created this program and broke it out as its own in 2019 because we saw such a need for wraparound supports for those families, because once that subsidy and case management ended, we didn't want anybody to fall out of our umbrella of care or our network of support. Family engagement was a program that originally started as a small service within our shelter and worked with families as they moved from shelter to housing. We saw such a need for it that got some funding to begin it as its own breakout program with the help of St. Luke's, and all of the programming is rooted in the Strengthening Families framework, which is a national best practice model. Our staff there develops all of our services, programming, and support groups rooted in that philosophy. Recently, too, a state-funded program that we were able to add, we're the sole provider in Cuyahoga County, is called the Family Success Network. It's solely funded by the Ohio Children's Trust Fund. It's specifically tailored to work with individual families to develop parenting plans, triage concrete supports that they might need. Again, all things we do have that thread of helping people to try and escape and avoid falling back into the cycle of poverty. We're in a pilot period with this program. This is year 3 right now, the second year where we're actually serving clients after an implementation year. The future of it is still kind of up for grabs as far as how that funding is going to go, but we're one of only 5 counties in the state that's providing this service at this time. And then we have workforce development programming. With the high barrier population that we serve, we know that we are not the only workforce game in town and not as specifically tailored to career pathways as some of the larger agencies that focus on manufacturing and such. But we are focused on trying to help people re-enter the workforce who have been chronically underemployed or never employed, do so through a 4-week program of soft skill development with the option after those 4 weeks to enter a culinary tract or a janitorial tract and connect people to employers in the community who have reached out to us to form more formal partnerships and provide a pathway to employment for those folks. Every year, we have a relatively balanced budget. Some years are better than others. But the chart above represents kind of the percentage of money that comes in and how it's deployed throughout the agency. As you can see, we run extremely lean. We're like a 90-10 split as far as, our auditors saying that 90 cents of every dollar goes towards service care in that regard. We do this all with the help of 32 full-time staff, 16 part-time staff. That number kind of ebbs and flows as we need it. 150 weekly volunteers that we rely on, and that comes to about 250 regularly scheduled volunteers a month, not counting the done-in-a-day volunteer groups that support us through the community. So as you can see, like we exist very much by the will of the people in many ways there. And as far as this ARPA assistance that was so generously funded to us from you folks, we focused it on our resource center funding. That program, more so than anyone else, is a self-funded enterprise for the most part. It's what we're most known for. We have to dip into our own general fund and operating coffers to do so. But as I mentioned, we've seen an exacerbated need this year, and I think that's visible to many, many citizens when you just kind of look out on the street. We've had tent encampments outside in our neighborhood. We've had an increased need for security. At the end of the third quarter of this year, we've seen as many basic needs services such as meals and and are outpacing the number of unduplicated individuals we intend to serve through that program this year. In addition, this funding allowed us to make some staffing changes and dedicate 1 position full-time to housing navigation, where we have people working one-on-one to find out how people might qualify for housing to take them from street level right to housing and surpass the shelter network, as we know that there's bottlenecks. Also in this trying time where affordable housing and housing inventory is such a huge issue, finding somebody who can focus on the pathways from unhoused to housing is such a gift to us at this point in time. So already through 3 quarters, she's found 25 people housing. In previous years, just through having the staff available who were kind of figuring it out, in a good year, we'd have 8 to 10 people housed through that, not focused on our shelter or other family housing programs, but this is focused more on individuals. And already through 3 quarters of the year, this program budget alone surpassed $700,000, which is not surprising to us as we budgeted it to be about $750,000 for the entire year, but again, outpacing. So this funding from ARPA has really helped us grow those needs and focal points of the program this year to focus on better outcomes rather than just triaging just the problem as it arrives at our front door each and every day, though we do appreciate the ability to give dignified service to those folks as well. Oop, my apologies. And that's ways that you can keep up with us if you'd like to at this point in time. But again, I thank the council profusely for their trust in us and for our community for allowing us to continue the service we've been doing for 47 years and, try and make new approaches to addressing the emerging problems of the people that we see and address and try and serve.
Thank you. Thank you, thank you. You know, the work that you do on a daily basis goes to our mission, the county's mission, and so we were very excited to be able to, something good came from COVID, right? To have the dollars to give your organization. My question would be, I've toured over there a couple of times, workforce development. I didn't see that you mentioned the pizza shop. How's it going?
The pizza shop, we have made the tough decision. We halted operations in August. We still own the business and the building, entertaining some outside partnerships. I hope to have something exciting to talk about in the next 3 to 6 months there. But yeah, it's, again, in an exceptionally tough year where, you know, money's always tight and everything, we were running it at a loss. And the impact and the profitability were the two big metrics that we would measure its success on, and both were kind of falling short in this past year.
Right. Also heard that there was, mentioned it yourself, is there a lot of families over there tenting outside or near the?
We're seeing more individuals tenting outside. You know, contextually and anecdotally from what me and my staff see all the time, families tend to stay in their cars. You know, it's a little bit safer and it has barriers rather than a tent. But we see more single adults starting to tent outside. And we are in partnership with the city of Cleveland on their Home for Every Neighbor initiative. And we're serving the case management pipeline of that with 2 staff members.
Any questions? Councilman Miller?
Madam Chair, to give me your name again, please.
Michael Burnett.
To Mr. Burnett. You mentioned the 70-plus folks on the waiting list for Mariah House. Where would those people typically be while they're waiting to get into Mariah House?
Yes, Councilman. As a point of clarity, the 76 people are on a waiting list with Frontline Services, who serve as the coordinated intake for the shelter system. So that 76 is not just for Mariah House alone. It's amongst the 3 family shelters. In the meantime, the 2 other family shelters have overflow shelter, which is a single night at a time where they continue to check back into coordinated intake. Some other providers have requested funding to try and put people up in hotels or try and do diversionary tactics or provide direct cash transfer to see if they can stay with a family member for an incentive. So there are many different tools being used by all the providers right now. For us, we're in more of a hurry up and wait. And when we're able to get a family out of shelter, calling 3 times a day to give an update to that coordinated intake to let them know what our inventory is. So as soon as somebody goes out, we get somebody in.
Okay. And Madam Chair, at our recent meeting that we had, I mentioned that when I was the chair of the Regional Child Abuse Prevention Council, that we struggled for 6 years to get the agencies to process enough people and get people through programs and get enough numbers to move the needle. Well, I just want to tell you that the West Side Catholic Center was the exception to that, and that they consistently provided high-quality services and met or exceeded the numbers that they contracted with us to provide, and they effectively spent the money that we gave them, and so I just want to say that I believe in you, that I think you're one of the elite nonprofit organizations in Cuyahoga County, and that you truly make a difference in the quality of life in our community, and appreciate all that you do.
Thank you, Councilman. It means a lot.
I also take a moment and a break to acknowledge Councilwoman Stevens is in attendance for this meeting. Any other questions?
Yes, ma'am, if you.
Councilwoman?
Because for me personally, one of the most important things that you do is the housing of families and individuals, getting them out of tents and into shelter. I believe the current phrase is the unhoused.
Yes.
Tell us a little bit more about how you help intercede on behalf of families. And then, because we've seen a growing crisis with unhoused individuals, how your new employee, or maybe somebody who was already employed by you, and you just changed their job description because they understood what was going on, how you're helping more people, and sometimes those numbers don't show up here, but you're giving guidance to folks.
Yeah, absolutely. You know, as I kind of mentioned, you know, when it comes to the family pipeline, you know, we're very well partnered with the Office of Homeless Services, with the county and the Continuum of Care and other providers. You know, being one of only 3 emergency shelters and having done this a long time in many different iterations, we had previously been a women and children's only shelter. We had been a DV shelter at one point in our history. The continuity that we've been able to provide in kind of knowing the system, the pipeline, and being able to be on the leading edge of any changes to the way that they operate has helped us move families through and advise them on how to best get through it. When it comes to the new staff position that we created, it is a person who had worked with us previously in more of a client services coordinator role. We found that her skill set was well suited towards this because it's such a big issue, to your point. And instead of relegating her to being this general, just help connect people to resources, we wanted to focus it more on the issue at hand. So housing first, and then anything else that's a barrier to housing because of her previous work experience, she's able to help navigate, whether that's, you know, identification or outstanding debts to utility companies and where we might be able to turn over some stones to help with any one client's case. So it's more of that individualized approach that we're able to offer now, rather than saying like, this is our system and this is how you navigate it. Like, we can walk with them a little bit more now with that. In the family side, it's a growing challenge, mostly because of the units available, the locations of units available, you know, more privately owned landlords and what they're able or willing to accept in regards to the vouchers and subsidies. We've been finding, mostly through our Home for Every Neighbor, but have been able to extrapolate that to the family problems, that some landlords, you know, do not want a month-by-month subsidy. They don't want a 12-month subsidy. They want guarantees beyond that. And that's become a sticking point. So locating the housing and having meaningful conversations and negotiations with landlords is an area of focus that I think that the city initiative is doing quite well right now, but we don't have enough people out there doing it.
Thank you.
Councilman Sweeney?
Thank you, Madam Chairwoman. Welcome.
Thank you, sir.
1977, my first year at St. Ignatius.
Were you helping across the street?
Do you still do sophomore service?
Oh, absolutely.
I mean, that was the easiest one. I went to St. Wendell's, but
Yeah.
how many, through the chair, how many kids about?
So they changed the nature of it a little bit. Instead of having the same like 4 to 6 boys, they cycle, so we get to see more kids throughout the week. So we'll have like a Monday crew, Tuesday crew, Wednesday crew, Thursday crew that are the same faces.
Because you're so close and
Yep.
interact well. Through the chair, I like how you branded yourself. I mean, West Side Catholic Center is branded, but you made that separation between Catholic charities, and that's the
Yes.
most well branded, but it's totally separate.
It's an important distinction, sir, because I think if we get lumped under that larger umbrella of, you know, like our pipeline doesn't reach to the Vatican in those coffers by any means. You know, we are an independent agency in the way that we operate, fundraise, and our ability to actually interface with, you know, the government and those entities. It gives us a little more freedom to do so.
And you do have yourself branded, but the way you made a distinction very early on was.
Thank you.
Had to think about it a little bit. The Catholic component of it.
Yes, sir.
Tell me a little bit more about that.
Yeah, it's a tip of the hat more to our origin more than anything else. We were founded by a group of religious, most of which were composed by nuns from the Sisters of St. Joseph and a couple of rebel priests, as we like to call them, you know, who saw this need for a ministry in the city. And actually, the part of our story I love the most telling is, you know, 47 years ago, somebody handed somebody a peanut butter jelly sandwich, and now I have a career. You know, it started that humbly by people just saying, we want to meet people where they're at and feed people, and then through progressive engagement and interactions, said, what else do you need? I need shoes, I need pants. The priests would go back to their respective parishes and solicit their people. But, you know, over time, we have our own 501c3. We have great relationships with local, you know, religious organizations that want to do good and help others, but we still retain our own identity to be able to operate independently.
And through just the Catholic thing gives you a comfort, even though it's just a nod to the beginnings.
Yeah, it gives us inroads to formalize relationships and let people know that like we're rooted in a values-based system in our operation and mission.
And through the chair, just the day-to-day operations, because when I'm driving down Lorraine, it's not every day, but sometimes there's a line out front waiting.
Yep.
And then you list all those services, and I just think those folks are just waiting for a meal. But some are waiting for a shower, some are waiting for this. And I have no idea how it happens, and the viewing audience is probably light,
Yeah.
but it's out there. How would one person dignified to be able to use your services and not be embarrassed or something?
You know, that's such a tough question to answer. However, you know, we just keep the doors open, you know, and we tell people that, and my philosophy towards all of our services is we're here to open doors. We're not here to shove people through, but maybe in opening that door and giving a little more context of what's on the other side, we can walk with them through it if we're invited to do so. So, you know, I think that by the virtue of the fact that the tents show up around us, the word's out that we're a welcoming place for people. And truly, yes, almost everybody who's there is going to be fed, because if you're there, you might as well eat, and we do a pretty good job with the food, I must say. We have volunteers who, you know, prepare the food every day for us. We do employ a nutrition coordinator to do the meal planning on site, so we're not, you know, just hamburger helper or anything. You know, we're making sure we're doing fresh produce and fruits and vegetables and all those kinds of things. But once you're inside, you know, we have a daily board posted of the services available on that day. You know, we do, because they're in the room, I would very much like to recognize Metro Health, who bring their mobile health clinic to us once a month and park right there on 32nd Street. You know, those neighborhood connections, they fortify us, and they bring new people to us by the virtue of their branding being outside of my place as well. One hand washes the other in that regard.
And through the chair, just my last point, this population sometimes stays a little bit. Knowing your schedule, they'd be like, wow, Metro's coming in 2 days, I can come there and get this service. And that's kind of cool. That
we make sure that we market those internally too, you know, like in an increasingly digital world, a lot of our folks still need to carry the paper with them. So, you know, we make sure that we have the handouts with, this is the day the mobile clinic's coming. As an example, these are the days of our food pantry partnership with the food bank. These are the days our volunteer podiatrist is coming in to see people. You know, we make sure that the internal marketing to those clientele who would, you know, would not otherwise know, we try and make it clear to them, you know, partnerships with legal aid and that advice as well.
well, keep up the great work. I would try to outdo Dale and praise for you, but I can't do that. He knocked it out of the park.
I'm so very grateful for the chance to be here in front of you today.
Thank you, Madam Chairwoman.
You're welcome. I just want to let you know, Michael, just in case you didn't, MedWorks Center for the Dental Clinic is going to be November 2nd at the Hilton Convention Center. So,
November 2nd.
yes, so please look on their website. Please get the individuals for dental services there. That I think they only do that twice a year. So free dental care, no questions asked. So please put that out on your network. Just wondering if you ever, for the community block supplemental grant that we offer here, have you ever tried to, since you're a 501c3, apply for that? I really would like your housing initiative to take off.
Is that the CBDG funding?
CBSG something we.
Yeah. I know that there's ESG funding and the CBDG money that's like somewhat tied together in some ways. I'm familiar with it. I do need to take a deeper dive into looking into it, because if that would affiliate with that housing, we're always looking for ways to help subsidize some
Yeah,
work.
we offer that twice a year, don't we? that supplemental grant?
It's just once a year.
Just once a year, but is it 30 applicants picked or
It's
more?
30 potential winners, $50,000 apiece. It's 1.5 million a year.
That is significant to us.
Yes, so please tell my colleagues a little bit about your housing initiative that you plan on starting.
Okay, thank you very much.
Oh, can you share a little bit about
Oh.
it? I know it's,
Oh, the housing initiative, you know, what we're doing right now, this is for Councilwoman Stevens, right? So with what we had done, and I've spoken kind of tangentially, so if you've grabbed a couple of pieces of it, we have moved a dedicated person into a role of housing navigation, you know, to work with the unsheltered community as they show up. With that increasing visibility of tents showing up, we are partnered with the city of Cleveland, but we saw a need because of the way that their pipeline's moving, that if somebody showed up after the fact, they were kind of in a wave to be held in the future, but we wanted more of an immediate responsibility on site any given day. So with that change, I noted to council in my presentation, 25 people have already been housed or
Right.
found permanent
I'm more
housing.
concerned about how you make that connection into permanent housing, because as I said to you earlier, I assumed that it's somebody who worked for you who would do a better job with this newly created position.
Yes,
The concern is the city has some units, Eden has some units.
correct.
Where are you finding units outside of the usual suspects?
I know that many of our placements have been in East Side neighborhoods with with private landlords willing to take vouchers and subsidy. That's been our third pathway outside of, you know, Eden, the city, and the usual, you know, players in that system at this point.
Because we need more folks to step up to the table, and finding ways to get private landlords to provide us with units is incredibly important. So congratulations on doing that.
Thank you.
Because a lot of folks are hesitant because to be unhoused, a lot of times people have gone through evictions, which landlords aren't willing to lease to people a lot who've been through an eviction.
The barriers have been tremendous
Yes.
in many cases, but, you know, I think it's finding people who truly want to participate in a greater community. And, you know, understanding that, you know, people own property with the idea that they want to profit off of it, I have no qualms against, but there's a reasonable breaking point in my estimation where we can serve the community, you can get what you need out of it, and everybody's better for it.
Do you use sometimes a guarantee of rent for a period of time to help get them in the units or keep them in the units?
As part of the housing navigator, she works with the individuals to see what they might qualify for as far as whether that's Treasury dollars or Section 8 housing, any one of those pathways. And those conditions are usually tied to the stream of funding in some way. So if we have the ability to have better negotiating power, we'll always use it.
You're welcome. So, Michael, so originally when I first wanted to give funds for Westside Catholic Center, there was a proposal about the housing
Yes.
that you were going to start down the street. That's the project I think will benefit with the community block supplemental grant dollars.
Okay.
Can you?
The acquisition of property?
Yeah, can you share a little bit about what you guys' plans were on that?
Our plans originally, at the time that this proposal was made, was to pursue state capital money, this money, as well as other funding streams to acquire 14 units where we would put our own families into at that point in time. On the brink of some leadership changes, specifically me taking over as the executive director at that point in time, a CFO turnover, it was kind of a perfect storm where getting into land ownership and the costs associated gave me and our board of directors great pause. I met with the councilwoman who so graciously let us kind of focus the money on our current resource center piece, and I wanted to make good on the fact that housing was such a critical issue to her that, you know, this is how we've kind of bridged the gap for the time being. The future is uncertain. I'm not opposed to trying to acquire properties. I am more interested in supporting agencies that have already done it successfully and seeing how we might be able to partner more strongly with them to either utilize our network, our partnerships, to bolster them in acquiring and having the units and allocating them to our specific clientele.
We thank you for your presentation. Thank you for showing us what Westside Catholic Center does every day. We were very thankful that we were able to provide some funding for the mission. Because as
Thank
I
you.
stated earlier when we started, your mission is the county's mission. So unless you have anything else to share, we thank you and look forward to when you come back with, you get the community block grant dollars, you get your 14 houses.
Thank you,
I just know
Councilwoman.
it's a housing crisis across the nation. I'm just trying to push housing, affordable housing.
And I appreciate you for being the mouthpiece for that, too. I think we need more people like you. Thank you so much, Council.
Business? Not at this time. All right, anything anyone wants to share? All right, meeting adjourned.
Good job.